Hi there, this is Dr. Tony Madrill with another 3 minutes for your mental health. In this video, I will be answering the following questions. 1, what is parts work in trauma therapy? 2, what are younger parts of the mind and how are they developed following a traumatic event? And finally, how can these younger parts be used in trauma work to enhance treatment outcomes? Parts work refers to the belief that we as humans develop certain ego states or personality states, if you'd like, in response to our experiences. When a trauma happens to a person, the mind may quickly adapt by creating a separate ego state or part to encapsulate and hold or store the traumatic material so that the person can continue on in their life and not be incapacitated. In a person who has experienced significant trauma, their mind may have adapted to it and look like the following illustration. The person's core self that helps them to self-reflect and to make decisions is represented by this blue ring I'm holding. And then the part that contains a traumatic material that becomes divided from the core self to help protect the person from becoming overwhelmed is represented by this smaller green ring. Trauma therapists may call this part of the mind younger because this is a part of the mind that holds the traumatic material, the distress from the traumatic event. Younger because it becomes developmentally stuck at the age when the trauma occurred and is only released when trauma work, trauma therapy can happen to process this traumatic material. How can these younger parts be engaged during trauma work to enhance treatment outcomes for the client? Once the therapist and the client have identified the presence of younger parts related to past trauma, the therapist can then engage the client in specific treatment protocols to begin to unburden those younger parts from having to carry all of that distress related to past trauma. Additionally, the therapist can then help the client to begin to reintegrate the separated parts of the mind back into the larger core self. What this means is that in time, the client will be less bothered by reminders of past trauma, and the limbic system of the brain will be less likely to activate the fight, flight, or freeze response when reminders of the trauma happen in the person's life. If you would like to learn more about best practices for trauma treatment, you are invited to subscribe to my YouTube channel. Thank you.